Every year, about 330,000 women are diagnosed with cancer, and the numbers don't seem to be decreasing. Of those numbers, 90,000 of these women are diagnosed with a gynecological type of cancer, while 240,000 women are diagnosed with breast cancer alone. With numbers this big, it's no wonder cancer is feared as much as it is today. While it is still a scary ordeal to pass through, cancer has become highly survivable depending on how early treatment starts. A good bargain seeing how the disease had one of the highest mortality rates. Diagnosing cancer as soon as possible to increase chances of survival may seem like an easy enough task, but detecting the signs your body uses to alert you of the impending danger may be more challenging than you think. As a matter of fact, a lot of these signs are often mistaken for minor changes in the body, a fatal mistake that occurs time and time again. To avoid missing telltale signs and unknowingly reducing chances of survival, it's important to know your body and be on guard against any changes that might indicate something is wrong. And by so doing, in the situation where a sign is noticed, it will not be too late to take the necessary steps. Before we take a step further, be sure to subscribe to our channel for more videos like this, and turn on the notification icon to never miss out on a new video. Now, let's have a look at 13 signs of cancer in women that you should always be on the lookout for. Without further ado, let's get buzzy. 1. Abnormal vaginal bleeding. A woman's monthly flow of blood should raise a red flag when it becomes anything other than monthly, between 21 to 40 days. When your monthly flow begins to have an abnormal pattern to it, it's a clear indication of trouble. Additionally, having blood flow after undergoing menopause is another sign that should be properly evaluated. Although any of these irregular bleedings may be caused by different reasons, one of the possible causal factors is cancer, hence the reason why it should not be overlooked. Reports show that over 90% of women diagnosed with endometrial cancer have experienced irregular bleeding from the get-go, and the majority of cases of cervical or vaginal cancer started as a form of abnormal bleeding. 2. Unexplained weight loss. Having to hit the gym day after day can be too much for some women to handle, and saying no to that extra tasty slice of cake is simply torture. That said, it's easy to see why suddenly losing tons of weight would simply be a dream come true for some women. However, if you do suddenly lose more than 10 pounds without changing your diet or exercise habits, it's no dream come true or your fairy godmother waving her wand. Instead, it's a sign for you to see your doctor. Because although extreme unexpected weight loss can be caused by stress or something else, it can also be caused by pancreatic or colon cancer. 3. Vaginal discharge colored with blood. Bloody, dark, or smelly discharge from the vagina is usually a well-known sign of a sexual adventure gone wrong, or maybe some hemorrhoids down below instead of an infection. But sometimes it's a sign that could eventually manifest into cervical, vaginal, or endometrial cancer. You should go see your doctor immediately if you notice this sign. 4. Heartburn. For many, experiencing heartburn is nothing out of the ordinary and is often as a result of the consumption of excessive food or alcohol. In those instances, all it takes is a few hours of rest and you're good as new. So you're probably thinking, why the fuss? Well, if the heartburn doesn't seem to be going away as it's meant to, it might just be something more troublesome. Heartburn could be a sign of throat, stomach, or even ovarian cancer, so always be on guard. And if your heartburn persists longer than it should, make a fuss and go see your doctor. 5. Constant fatigue. A stressful day or a busy week can give anyone little to no reason to get out of bed for days. While this is understandable, in most cases, a few hours of rest should cure your fatigue and leave you energized for the next day of, well, more stress. With that in mind, it goes without saying that if the fatigue seems to be overstaying its welcome, it might not be just what you think it is. Cancer tends to use body nutrients to nourish itself and grow. When present, it steals nutrients from your body, which in turn leaves you deficient and, more often than not, extremely tired. So if you're constantly feeling tired, it might not be you having a lazy day, but rather your body raising some cancer cells. 6. Loss of appetite or feeling full all the time. There may be several various reasons for a loss of appetite, like bitter taste buds, food poisoning, or probably just bad cooking. A less known reason is that ovarian, lung, stomach, and pancreatic cancers are common causes of appetite loss. The cancer tumors release special hormones that may change your body's perception of hunger, making an empty stomach feel like one that just went through a banquet. Cancer also causes symptoms that could reduce your appetite, such as nausea, pain, stress, depression, and dehydration. 7. Pain in your abdominal area. Abdominal pain can be caused by several factors, and most of them are not much cause for concern. What becomes a cause for concern is when it continues to be a pain in the gut for a long time. Persistent abdominal pain can be a sign of either ovarian or endometrial cancer. Cancer also causes a lot of gastric discomforts, including gas, indigestion, pressure, and painful cramps. Consult a doctor at the slightest sign of all of these to be in the clear. 8. Changes in your bathroom habits. Needing to urinate all the time or feeling constant pressure on your bladder can be the result of a urinary tract infection, UTI, bladder stones, or simply an overactive bladder. But in cases when you did not pick up the habit of drinking more liquids or you become pregnant overnight, this may be a sign of bladder cancer. 9. Skin changes. Your skin is the largest organ of the body and can be an excellent indicator of your overall health. Jaundice, which is the yellowing of your eyes or fingertips, is one symptom that could indicate the movement of cancer cells in your body. Go see your doctor if you do notice any signs of jaundice on you, and also be on the lookout for any other irregularities on your body. One of such is a change of moles on your body. If you notice them becoming asymmetrical, developing jagged edges, or becoming abnormally larger and darker, it can be a sure sign of cancer. 10. Change in bowel habits. A change in your bowel habits may be a sign of something pressing down on the colon. This could be an advanced stage bowel cancer or other cancers. Bowel cancer is one of the most common types of cancer diagnosed in the UK. There are fewer types of cancer more likely to affect you. Always keep a poll on your poo and consult your medical advisor about the slightest change in your bowel habits. 11. Changes in your breasts. Being the most common type of cancer worldwide, breast cancer is a notoriously known killer that manifests in the breasts. That is why most breast cancers are noticed by women themselves during routine daily activities like bathing, shaving, or even feeling around. If you do not know what to look for, be on the lookout for lumps in the breast or armpit. Also, be on the lookout for changes to the skin on your breasts, changes in the look and feel of your breasts, abnormalities in the nipple and areola region like discharges from the nipples turning inward, and any area of redness around the nipple. 12. Bloating. If you are a woman, it may be common knowledge that bloating occurs a lot during the menstrual cycle or maybe one too many pizza slices. If the bloating, however, does not subside at the end of its usual run on your body, it becomes a problem. Constant bloating can be a sign of colon, ovarian, gastrointestinal, or pancreatic cancer. Consult your doctor immediately if a case of bloating overstays its welcome. 13. Fever. Fever is a common sign of the body going through the flu or cold. It's the body's answer to an infection that clears up on its own soon after in most cases. But the less common side of the flu herald is that it is a sign that cancer has spread all over the body or is at an advanced stage, especially if the person has a blood type of cancer like leukemia or lymphoma. While fever is rarely a cancer symptom, it doesn't hurt to be extra vigilant when your life is at stake. Outro. These are some of the common signs of cancer, and just as there are countless variations of the killer disease, there are countless other signs to look out for. Be sure to get a regular checkup with your doctor to detect any signs your personal detection may have missed. Keep a proper healthy lifestyle by exercising regularly, eating a balanced diet, and doing without harmful habits. Learn to be on guard against the slightest change in your health. Cancer is a dangerous killer that has already claimed the lives of women worldwide. Ensure that you can always be one step ahead of the killer so that you can have a fighting chance if it does come knocking on your door. If you notice any of the signs in the video, be calm and consult a doctor today. Let us know if this video has been helpful to you in the comment section below, and also drop any ideas on the types of videos you'd like to see. Don't forget to like and subscribe to the channel. click on the bell icon to always get notified of our latest videos. Thanks for watching. Until next time,